Good afternoon. My name is Charlie Stott, and I'm co-president of the Nantucket Civic League, which is a federation of 25 neighborhood associations with about 2,000 members. The Civic League's mission is to preserve the island's resources, to improve island living, educate the public on island issues, and encourage participation in island government. And I'm pleased to welcome all of you, as well as the viewers on Nantucket Cable Television Channel 18, to today's state legislators' town hall meeting. But before I introduce our special guests, I'd like to conduct a quick show of hands survey about how you learned about today's event. How many saw the advertisement in the Inquirer and Mirror? About 10. How many heard the radio spots on AC FM? Okay, how about word of mouth? 6. Maying about town? Email or social media? The majority. Okay, thank you. The way this is structured, the state senator and state representative will each make an opening statement about their work on Beacon Hill, the legislative issues they face, and the status of key bills. Then they'll welcome questions and comments from members of the audience. But I would encourage you to keep your comments brief in order to maximize the opportunity to hear from your elected officials. And now, please give a warm Nantucket welcome to State Senator Julian, who is seated to my left, and to State Representative Dylan Fernandes, who is seated to my right. Thank you both for coming. Julian?
Good evening. Thank you to Charlie and Peter. Is your mic on? Is my mic on? Is my mic on? Good evening. I'm State Senator Julian, and I have the tremendous privilege and honor to represent Nantucket, as well as most all of Cape Cod. The district stretches from Provincetown to Mashpee, and then also Martha's Vineyard and the Elizabeth Islands. And thank you, Charlie and Peter and all the members of the league, of the Civic League, for organizing not only this event, but I think many of sort of the most important forums that we participate in have your imprinter on them. So thank you for making that happen, and especially thanks to the Athenaeum for hosting us yet again in this awesome space. So for those of you who are just still getting to know me, Dylan and I are in month 10 of our positions working for all of you folks in the State House. Prior to joining the State Senate, I spent a lot of time working in public health, working in social justice issues at the state level. And I think that when the opportunity for State Senate, when this seat came up and the opportunity really came, I really thought of my community where I grew up, a little town called Truro. We're actually quite small compared to you folks here in the metropolis of Nantucket. Truro's got a year-round population of about 2,000 people. You got to go from Provincetown all the way to Orleans to get 7,000 people. So you're about double that here on island year-round. So it feels like I'm coming to the city when I'm on Nantucket. But this place very much reminds me of my community and the challenges we're facing in my community and across the challenges we're facing across the islands and the Cape. We have become profoundly unaffordable. Our communities, it is harder and harder to folks to get a foothold in here, to come, to build a life. I look at my family's experience. My family were refugees from Bristol, Connecticut, who got out of Bristol and moved to the Outer Cape, built a life, worked in food service, and it was not sort of a special story to be growing up on the Outer Cape or to growing up on Nantucket, where your families made a life on either in hospitality, in food service, in the trades, in fishing. And now, as we all know, that's become harder and harder to do. And so when I ran for State Senate and Dylan shortly thereafter running to represent this part of the region in the House, I think really tried to raise up, the real inflection point that we are in our communities, and that for all of us, not just folks who look like me, but due to a real lack of housing, due to a real lack of opportunities that people have to make a life largely driven through housing, also through the isolation we face and the mental health challenges that we disproportionately have here on island, that we have on the Cape, an opiate epidemic that's really ravaging our communities and affecting our communities, and particularly younger folks in our communities at a pretty high level, and the other fact that we live on a pretty fragile spit of sand, whether it's on the Cape or whether it's here on Nantucket, and that protecting and stewarding our fragile environment is so key. Yes, for the beauty of this place that we all call home, but also because clean water and a pristine environment really is the good that we offer to the world. Is what we have from an economic development perspective. And so those are just some of the issues that we've been grappling with and thinking about, and trying to really make some significant progress on, both on Beacon Hill and with all of our communities. Partnership with communities is really key. Massachusetts is the Commonwealth. We have 351 distinct municipalities. So much of the critical work that we do here on the local level is in partnership with our towns. And so we've been working with the Board of Selectmen, with the town manager, with folks on affordable housing, on behavioral health, and others here on island, in partnership with folks here on Nantucket and all of our communities. Because there's really so much of what we do at the state level is implemented at the local level, and so many of the challenges that localities face have to flow through the state in some way. So I think we'll get into certainly talking about housing and housing affordability. You folks have a very important home rule petition around a housing bank that Dylan's done some really great work moving this bill. It's a hard bill to move, and he'll fill you in on that. We've been looking at issues around Nantucket's fishery, and particularly I think that the pretty significant impact that the national squid fisheries had on our environment here, looking at the needs of folks who need to get off island for off-island transport. I can talk a little bit if folks want about some of the efforts we've been trying to push around wastewater and looking for opportunities to help the towns across the region meet the demands posed by the need for wastewater in some of our communities. Nantucket, you guys are further ahead than most of the communities I represent, but still a big challenge here. So it's just wonderful to be with you folks. It's really wonderful to be here with Dylan Fernandes. Dylan has been doing a heck of a job on Beacon Hill. If you look at, not that politics is a horse race, but if you look at kind of committee assignments and bills that have moved and the amount of money that he's been able to secure in the budget, he's really been the most successful of his freshman class, which has about, I think, 18 or 20 members. So it's a real joy to watch his success, and it's a real privilege to work in partnership with Dylan and all of you. So I look forward to your questions and having a really good conversation.
Well, thank you, Julian. So I'm Dylan Fernandes, state representative. I represent all of Nantucket, all of Dukes County, which is the Vineyard and the Elizabeth Islands, and also my hometown of Falmouth. I only represent half of it, which is kind of odd, but I live down in Woods Hole. That's been my hometown. And so I'm a fourth generation resident of the district. My family actually came here from the Azores. They, like a lot of kind of Portuguese families, came here, and they started a small farm over out in East Falmouth. They're strawberry farmers, and Massachusetts used to be the #1 exporter of strawberries in the United States, and this was in large part because of these Portuguese immigrants that came to the state. And so that's kind of my family background. My father, he never went to college. I don't even think he graduated from high school, but he started a small business, a small landscaping company, worked really hard to see it grow, and he got to witness the reward of his hard work when I graduated from college, the first person in this very large Portuguese family to do so. He had 9 brothers and sisters. And so this, what kind of compelled me to enter into politics was really kind of that background of being able to give back to the community that's given me and my family so much, and also that aspect associated with social justice and lifting people up from all different backgrounds and making sure they have an opportunity to succeed in our district and really across our state and country. And so that's kind of why I got into politics. I started out working for Elizabeth Warren. I went on to serve as Maura Healey, our Attorney General's political director. Then I went into the Attorney General's office and worked in civil rights and consumer protection and the like. And so that's when I quit the Attorney General's office and took this kind of big leap to run for state representative. And it is just an honor to serve you at the State House, and it's an honor to serve the entire district in the State House. I'm a little biased, but I think this is the most beautiful district in America. I mean, and it's, I had a delegation from Hawaii come visit the district, and they were looking around like, this is nicer than Hawaii. And I was like, yeah, it's... So when you get those compliments, you know you live in a really special area. And, Nantucket specifically is a really unique community, and it's a really special community, and it's unlike any other community in the entire state. And with that comes some really unique needs. And when I look at Nantucket, when I look at the district, kind of the three biggest issues that I've been focused on, and look, there's a number of issues facing us, but the kind of three biggest ones that I've seen are affordable housing, or lack thereof, the opioid and heroin epidemic, which we have some of the highest, our district has some of the highest death rates in the state, and Massachusetts has some of the highest death rates in the country. So we're really at the epicenter of this epidemic. And also environmental stewardship. I mean, I represent 9 islands, right? And so when you talk about kind of the effects of climate change, when you talk about sustainability, those issues impact islands more so than any other region in our Commonwealth. And so those are kind of the three kind of core issues that I've been focused on at the State House. Those are the reasons why I requested to be on the Committee on the Environment and Agriculture, the Committee on Mental Health and Substance Misuse, and also the Committee on Municipalities and Regional Government, which you guys are probably thinking, like, why? That sounds boring. Why would you want to be on the Committee on Municipalities and Regional Government? And that's because all of the home rule petitions that are filed on the local level go through that committee. And so all of Nantucket's home rule petitions go in front of the Committee on Municipalities and Regional Government. And you guys file a lot of home rule petitions, more than I think any other municipality in the state, which is great. But in order to shepherd those through and kind of move those forward, it's really important to be on that committee. And I believe Senator Sear sits with me on that committee as well and has been doing a lot of work to move some of these Nantucket initiatives forward. And I want to talk a little bit, so we want to open it up for questions, but I want to talk a little bit about what we've been doing around the affordable housing bank here on Nantucket, because we've been working incredibly hard to move this piece forward. Tucker, who's here, has been up to the State House on several occasions to advocate for this bill, along with a large group of Nantucketers. We've moved this bill successfully through 2 committees, and it's finally sitting in the last committee before it gets engrossed in the House. So the last committee before it passes in the House. And to those who are not familiar with the bill, although I think most people are, it's just a 0.5% transaction fees on home sales over $2 million. So a $3 million home has a transaction fee of $5,000 that goes towards an affordable housing bank. And we all know that lack of affordable housing is driving young people, working families, and seniors out of our district. And we all have a lot of great ideas about affordable housing. There's no shortage of good ideas, and fortunately on Nantucket, willpower to have affordable housing. The biggest issue when it comes to affordable housing is how do you fund it? It's the funding mechanism. And if we get this passed, this will be a kind of, what I hope is a kind of generational approach to affordable housing here on Nantucket that allows Nantucket to be a sustainable community. And I also want to talk a little bit when it comes to the environment about a recent bill I filed around allowing local towns to restrict pesticide use. We've seen this a lot on the state level, especially around neonicotinoids, which we're finding more and more about how neonicotinoids is this pesticide that's starting to kill a lot of our pollinators, like the bees and the butterflies. And our agriculture relies on these pollinators to sustain our crops, right? And so this huge die-off of bees is in large part because of these neonicotinoids, along with other factors. But this allows local municipalities to ban or restrict certain pesticide use. And I think it's really important that the local community should decide what is going into their drinking water and what chemicals are being put in their bays and estuaries and the like. And Rachel Carson, who actually worked in Woods Hole, my hometown, for about 5 years at the Marine Biological Laboratories and the Woods Hole Oceanographic Institute, really kind of moved the nation on this. I think it's time to kind of reaffirm our commitment to pesticide and chemical restriction here in Massachusetts, and this bill would allow and empower local communities to do that. And so a couple other things that I want to mention, which we can get into separately during questions, is ocean acidification, which is another bill that I filed to address our rapidly acidifying oceans, which is causing our shellfish to be unable to calcify, and if they can't form shells, they can't exist. We have a huge shellfishing operation here on Nantucket. And the other piece that I hope we bring up during this meeting is around pot legislation, around marijuana legislation, because this is one of the biggest pieces of legislation that passed the State House, and Senator Sear and I secured a Nantucket-specific amendment in the bill to make sure that the state is looking and issuing special regulations for the islands of Nantucket and Martha's Vineyard when they're issuing regulations around marijuana use. Because unlike any other municipality in the Commonwealth, the Vineyard and Nantucket, in order to get there, you have to travel through federal regulated water, because the Coast Guard regulates the water, and federally regulated air, because the TSA and the FAA regulate the air. And of course, marijuana is illegal on the federal level, right? And so how do we, so it makes it really complicated, especially for towns like the Vineyard and Nantucket that voted overwhelmingly in favor of question 4. We want to make sure that the islands are treated the same as the rest of the state in terms of access and care. And so there's a lot of issues that I hope we dig into today, but I'll just close by saying it's a true honor to represent you, and my office is always here for you. Where I'm here very regularly, probably at least twice a month. Tom Dixon is the island liaison to Nantucket. He lives here full time. You can always reach out to Tom, but reach out to our office with really any need, even if it's not something that we work on. If it's a state issue, we can at least connect you with the correct state agency. And we've had a lot of people from Nantucket reach out about specific constituent issues. So reach out to our office and we'll connect you with the appropriate services. Thank you.
Well, thank you, Representative Fernandes and Senator Sear. We'll now open it up to questions and answers. And I view my role as moderator as to not inject myself so that I get between the elected officials and their constituents. So if you have a question or comment, please just raise your hand and I'll call on you and we'll get a microphone over to you and you can direct your comment to either legislator or both. Yes, sir.
Thank you. Would either or both of you fellows help us figure out a way to keep more of our deeds excise tax? That it's the tax that's collected from both the buyer and the seller of property. Yeah. And I checked the statistics. I found out Nantucket County turns over 82% of the money it collects to the Department of Revenue. And there are only 5 counties left. The only one I could find numbers for comparable was Dukes County. Dukes County keeps 40% of their money. We have needs because we're on an island, as you just noticed. Specifically, the Health Task Force is now working on ways to pay for off-island transportation for people with medical or psychological or legal problems. And when I heard about the problem, it seemed to me it's a geographic problem. It's because we're 30 miles away. We can't tie up half the police force just transporting a person to and from. And I don't know where to begin to start the process, but you look like smart guys. Could you help us figure it out?
Sure. So, we were actually just at a meeting with the fire chief, the new chief, Chief Murphy, talking about actually the transport issue, and I think specifically on that, where there are some off-island interests as well that need to be part of the conversation. Count on us to be part of that conversation. On the deeds, the portion of the deeds tax that goes to the state, Representative Josh Cutler, who represents Duxbury, has filed a bill that actually most of the Cape and Islands delegation has supported, and essentially would give counties, the remaining sort of existing functional counties, more access, more leverage over those dollars. Broadly speaking, kind of county government in Massachusetts several decades ago was disbanded in response to some corruption. I think in our neck of the woods, counties are really vital. Actually, Nantucket, you folks have a little bit of a luxury in being one island, one town, one county. There's some nice simplicity there. If you talk to your friends in Dukes County and Martha's Vineyard, they've got one island, 6 towns. Cape Cod's 15 towns in Barnstable County, but really on Dukes, and especially in Barnstable County, where you really see a significant amount of services that the county provides that the towns couldn't do themselves. So, for instance, dredging is a really kind of critical but unexpected example around how the towns are able to pool their resources through the county. So that's a bill that's been filed. I support it, and I think that part of the challenge, specifically on the deeds piece that the state takes, is that most of our colleagues don't have a conception of what a county is or what those needs are. We should look at the numbers specifically as far as why is the Vineyard it's gotten more of a portion of that than Nantucket. It may have to do with the fact that there's 6 towns, 1 island, and there's more county. I don't know the answer to that one, but we should look into that because certainly there should at least be equity.
Does the bill have a number?
We can find that for you.
Tom and Pat can look that up. And actually, I should have said Pat Johnson, my chief of staff, is here with us, and they're furiously looking for the bill number. And when we find it, there's over 8,500, almost 9,000 bills filed a session. So I try to remember the policy area and the topic, but sometimes remembering the bill numbers gets tough. But we'll get that to you later in the break.
And I'm a co-sponsor of that bill as well.
Would you folks speak directly to the microphone?
Sure. Can you remind us of the timetable in front of us for implementing the full legalization of marijuana in the state?
So it's gotten off, as you might have read, to a slightly slow start, and they've kind of been behind on a couple benchmarks, but they're not as behind as they were with medicinal marijuana, which is a good thing. So today, actually, so right now the Cannabis Control Commission is going around the state and having public hearings from folks about how they want to see, how the local communities want to see it being rolled out. And the Cannabis Control Commission has to issue regulations under this new kind of body that has been established to regulate marijuana. The regulations for our special amendment will be coming out in May. That's part of the law, is that they come out in May. And so what Senator Sear and I filed was a piece that basically addressed the issue that I talked about federal waters. And our piece specifically says in the bill that the Cannabis Control Commission has to issue special regulations to accommodate the unique geography of Dukes and Nantucket counties. And so this is a really important piece because it gets at, testing. A lot of times you have to get your marijuana tested at a testing facility. A testing facility is not going to be opening up on Nantucket, right? I mean, it just won't be feasible here because there won't be enough marijuana kind of shops or grow operations to make it feasible. So that means in order to test it, you might have to go over to the mainland. Well, how can you do that if you can't transfer pot over federal waters, right? So there's a lot of really kind of fascinating and intricate issues within this pot bill, but one of the things that we're doing after getting that amendment in, which was, I gotta say, like quite a feat. There was well over 100 amendments filed to this bill, and this was one of very few that got in. But one of the things that our offices did today, the Cannabis Control Commission is actually on the Vineyard today to talk about kind of island-specific issues. We've been working with advocates on the Vineyard, and I believe one or two folks from Nantucket to talk about what we want these special regulations and accommodations to look like. And that is in large part around testing. It's in large part around kind of grow operations. You're not going to have this kind of massive, commercial grow op on Martha's Vineyard or on Nantucket because there's just not the land available. So making sure there's co-ops available for growing marijuana. And this isn't about, and we're not saying the island needs to have marijuana. What we're doing is giving both islands the tools to have the same access to it if they do choose to have it. So you can still vote it. You can still vote as a town not to have it. I expect the town probably wouldn't do that because I think it passed by 20 percentage points here. But my hometown of Falmouth is voting to not have local recreational marijuana. I think all the island towns will not be taking that up because they, as a region, Martha's Vineyard actually voted for it by the highest percentage as almost any other region in the state. Actually,
I believe the highest was Provincetown, but not.
Well, as a region.
Not to brag.
As a region, not as a town. Like three of the Martha's Vineyard towns were over 70%, which is quite a bit. But so.
What's the time schedule for the Cannabis Commission to come up with their statewide proposal?
So that should start in sometime in January, sometime early winter is when the timeline should start. When we passed the bill, the goal and the aim was to have recreational marijuana shops open by this coming summer, by mid this coming summer. We're still on that timetable. It might just be pushed back a week or two.
I'll add to that. I lived through medical marijuana implementation, or at least the drafting of these regulations when I worked at the Department of Public Health. It's a tremendously intricate industry, and I think when you look at what happened with medical, I think we actually did a good job of a state of rolling out some pretty comprehensive, sort of first-in-the-nation regulations. And then what really got tied up and really what sort of tripped up that rollout in the process was that under the law that was passed by the voters, each county basically could have up to 5 medical dispensaries. And so there had to be some sort of picking and choosing of who got to open what dispensary first. And that became, frankly, really political. And I think really kind of jammed up the process. The good news here is under the Cannabis Control Commission, basically, if you meet a certain amount of criteria, it's up to your engagement at the local level around siting and how many and all that stuff. I would urge, I think that being a little more thoughtful about this is a good way to go. I'm really interested in how do we make sure that, from a public health perspective, I'm most concerned about recreational marijuana. If it's a really consolidated corporate industry, the amount of influence that's coming into the state, the amount of money that's coming into the state around trying to guide and determine regulations and policies that are favorable to folks who've done industry out west, I'm really concerned about it. I think that you see some of the biggest challenges, whether it's in any sort of like sin area, right? When you have big tobacco or big alcohol. I originated and filed legislation to create successfully craft cultivation. So this is allowing for smaller scale marijuana cultivation, which Dylan mentioned, and basically allowing sort of a lower bar for folks to get in. You know, let's be honest, we have an existing marijuana market in the Commonwealth of Massachusetts, and we have an existing marijuana market here in Nantucket. And the real question, and I think what remains to be seen, is the black market really brought into the legal recreational market? And I think if we don't do that, there's a whole host of missed opportunities and concerning pieces with that. From a rollout perspective, it is, mid-July. There were actually 2 listening sessions. We just had a listening session last week in Hyannis. I actually was the only senator that had 2 listening sessions in a district, and we had them do it in Hyannis right at the town hall and invited folks from the island. So, you know, we couldn't get them to do hearings on both Martha's Vineyard and Nantucket, but, you know, there was some proximity there. I think there were a few islanders who attended. So that's the timeline. I would not be shocked and surprised if there are some delays. I think that it's important to get it right, but just given the complexity of these regulations and having kind of sunk my teeth into them on the medical side, I understand why it's so complicated. I mean, essentially, you are creating the rules of the road for a new industry, and so there's winners and losers in that, and that creates that's really tough work. I don't envy the 5 members of that panel, even though I do have relationships with several of them.
You know, you mentioned craft growing. That could be appropriate for the islands.
That's exactly the intent. So under craft cultivation, there's essentially a lower bar to entry, smaller cultivation, and then the idea is that you would meet all the regulatory requirements through a co-op. So actually we base this kind of similarly on how some places have done shellfish cultivation, right, where you have a smaller grant and then you're able to sell into a wholesale dealer who does the testing and helps you meet some of those health and safety requirements. So that's craft cultivation, frankly, is exactly intended for basically communities like Nantucket, communities like the Outer Cape. I think also from a market perspective, there's a value-add product there, and there's some desirability to that potentially. And so we wanted to make sure that smaller local producers had it in here, and that this doesn't become, you know, some big corporate warehouse in Worcester County.
I've been intrigued with the idea that broader use of recreational marijuana, including edibles, might be an answer to the opioid epidemic. I was wondering how you two feel about that. Do you think there's any validity in that?
Yeah, I mean, so there's been a couple studies that have come out that show that marijuana can effectively combat pain, and that's why a lot of people use it for medical uses, is to mitigate their pain. And obviously, it's significantly less addictive than opioids or heroin. So if it's an effective alternative to opioids, then I think absolutely it's something that's already being explored, right? Because we already have led the way for medicinal facilities, and now that it'll be recreational, people can, you know, get it without a doctor's note, right? So you're mitigating those barriers. You know, when it comes to the opioid and heroin epidemic, there's just a lot of pieces that we haven't fully solved. You know, the House and the Senate and the governor signed a bill, I think 3 years ago now, which really got at the oversupply of opioids and the overprescription of opioids. I think in 2014, a bottle of opioids was prescribed for every single adult in the state of Massachusetts. That's how many of these pills were in circulation. And we know that if you just take them for, you know, a couple of days or a week, it can already become habit forming. You can already get addicted. So working on that kind of oversupply issue is really important to addressing kind of the cause of this epidemic. But we also have a lot more work to do when it comes to prevention. You know, Barnstable County, I think, spends less than 2% of its funding on the opioid and heroin epidemic on prevention, right? And we know that once you become addicted, it's 6 to 8 years before you recover, with profound financial and human costs associated with that. So one of the things that Senator Sear and I have been focused on is, how can we get preventative training, preventative curriculum in schools at a young age to make sure people are not being hooked on this in the first place. And then also, on the back end, there's a lot of issues. And I filed a bill that addresses this. There's a lot of good information and good data out there about short-term treatment and the effectiveness of detox. Detox works. We know detox works. There's a lot of data proving that. What we don't have a lot of data on is long-term treatment options. So 30-day, kind of 2-week, 30-day, 60, 90-day treatment options. And there are so many different options out there available. And I'll pick on, in Falmouth alone, you can do NA, you can get acupuncture, you can do kind of organic farming, there's equine therapy. There's all of these different options out there, but not a lot of data to show which ones are the most efficient and which ones are the most cost effective. And if we as a state are spending millions of dollars on this epidemic, and by the way, if your family is spending thousands of dollars on this epidemic, we really need to know which treatment options, which long-term treatment options are the most effective and which ones are the most cost efficient, so that we're saving not only the state money, but we're saving families money. And also, most importantly, we're giving those who are struggling with addiction the best treatment option out there that is available. We just don't have that data right now. So I filed a bill that would set up a commission to study the long-term treatment options we have in our state and in our nation, and make recommendations to the legislature on which ones are the most effective and cost efficient, so that we can aim our resources and encourage people into the treatment centers and the treatment methods that are the most effective. And so, we need to have data-driven, proven treatment options, and that's another kind of piece of this epidemic. But it's a full spectrum of pieces that we need to address.
Yeah, I think Dylan's point on continuum of care is a really good one. Specifically, I think when you look at marijuana, right, this is potentially another tool in the pain management toolbox, right? Opioids were something that were actually used as a drug during the Civil War, and physicians, frankly, abandoned them because of concerns around addiction until a real concerted effort around pain management and the emergence of opioids again in the 90s, right? I think the challenge with marijuana is that because it's been just illegal at the federal level and no one's been able to research this, we haven't actually been able to, I'd really like to see a lot more effort really put into looking at, like, all right, from a pain management perspective, I think anecdotally we know for some people it works. But I think sort of more immediately with the epidemic, right, we're still in a point where we're in the process of just saving lives. I think if you look at the opiate overdose leading to death data, it's a pretty stark picture, actually. Barnstable County just released a report. It's really interesting about looking at employment and certain factors of individuals who died from an opiate overdose from 2004 to 2014, basically when they had the data in Barnstable County. 69% of those individuals had a high school education or less, and 25% of them were engaged, worked specifically in construction, and nearly half of them are in services broadly within which construction is part of that. So I think from an intervention perspective, I think we need to do a much better job focusing intervention and treatment for those populations specifically. I think that data is very clear. And I think especially for people who in our communities who are, we all know this, have, we have seasonal economies, right? There's a lot to do and there's not a lot to do. And especially for folks who don't, kind of get off island. We really, I think, need to be paying specific attention to those folks when we're looking at saving lives. I mean, I think we're still very much at a point in this epidemic. We haven't, if you look at the data, at least for southeastern Massachusetts, we've not rounded a corner. I think we've gotten better at reviving people and saving lives through Narcan, but we really have a long way to go on this epidemic, and I think that we need to be, we need to really throw the kitchen sink at this problem, at this epidemic, I think in a way that we did in the HIV/AIDS epidemic, really thinking out of the box on interventions and strategies that might kind of be unconventional and might make people uncomfortable, but if there's some evidence around that, we should be looking at that. I don't think that we've done that fully here in Massachusetts, and I think until we do, I think unfortunately you're going to see those trends continuing. If anything, just a plateau in the death data, which is what or in the deaths caused by opioid overdose, which is what we're seeing. Sort of the better numbers in certain regions. But I found that employment and education analysis that was done by the county of Barnstable really compelling. And I think that we need to be looking a little more towards how do we really target those interventions. I think we've done a better job talking about opiate addiction. We're talking about stigma and shame broadly, I think, as a community in a way that we weren't doing 5 or 10 years ago. But I think we still have a long way to go.
To your conversation about the prevention of opiate addiction, so this may seem like a generalization, but we have those folks who are addicted, and there's a series of strategies that need to be, to help those folks. But we still have a prolific use through the prescriptive authority of providers who are writing these prescriptions. And there are a lot of things that can be done on a regulatory basis which you might think about in terms of regulation of medical profession. But just a couple quick examples. There's been actually an interesting series this week, every night on PBS about the opioids, and one of the case studies they did last night was Kaiser Permanente, which is a big HMO medical provider in California. They've reduced their opioid utilization by 82%. Through their information systems, by telling people don't do it, these are alternatives, and so there's changes in human behavior of the providers that are ordering this stuff that need to happen, and that can happen. Secondly, there hasn't been, oftentimes the first order is to write a painkiller if you come in with back pain, like the trades you were talking about. There's a group of folks nationally, including a guy by the name of Dr. Steve Atlas at MGH, who's has identified a number of ways to prevent the need for opioid, or at least have that as the last, including physical therapy and all those kinds of things. So encouraging that through the government to do of those efforts, maybe through grants and things, I don't know. Or as you look at the regulations for hospitals and the AMA or whatever licensing authorities to require certain behaviors might be helpful.
We've been watching the same program or listening to it in my case. I think in Massachusetts, you raised some really good points. In Massachusetts, one area I think we've been a leader in where we have done a really good job is in the monitoring of the prescribing of opioids. So we have something many states have a prescription monitoring program. When I started off working at the Department of Public Health 7-8 years ago, we could barely get any docs to opt into it. And there was a lot of resistance to using this system. Now the system is used not only by prescribers and docs, but also by pharmacists who also review the PMP when they're writing a prescription. There's restrictions on first-time opioid prescription. So prescriptions of opioids have been cut in half in Massachusetts, and I think that we're going to see that go further. A lot of promising things, I think, on the alternatives piece. Actually, there's been some really compelling evidence done around basically using virtual reality, which again sounds a little like, what are you talking about? And the evidence on this, I think this was in the same report, really shows that that's very promising. So I think on the prescribing piece, I think we've been doing a good job. We need to keep that up. But the challenge is that for folks who are already addicted, we were actually meeting with there's a working group of state senators that meets every few weeks to really talk about out-of-the-box ideas around opioid intervention and prevention and treatment. And we actually work with there's actually several user advocates, right? They're users themselves. Which gives you a really good lens into sort of how this epidemic is lived. And what's happening now is, and what I've been told is, you cannot get heroin in eastern Massachusetts that is not laced with fentanyl or carfentanil. These are substances that are 10 times or 100 times stronger than heroin. They are so potent that actually there's been 2 cases where emergency response police dogs have had to be revived with Narcan because they've come into contact with it. So the emergence of the fentanyl and carfentanil is, while we're doing a better job sort of saying, all right, we're restricting the amount of, opioids that are prescribed, we're changing the culture there, we're getting folks to really think about, the unused opioids that are sitting in all of our medicine closets and cabinets. The emergence of the carfentanil and fentanyl piece is just, it's a potency we're not used to. There isn't going to be an effort, I think, in criminal justice reform. I know there are some questions on that. That are going to look at those substances. Currently, they're not part of a scheme right now because they weren't seen as an issue. It's really eroding the successes I think we've seen with prescription monitoring because of the potency.
Question over here.
Thank you. Hi, thank you both for being here. My name is Vanessa Emery, and I work for the Nantucket Behavioral Health Task Force. And I have a question about healthcare reform. So one of the barriers, my understanding is one of the main barriers for providing behavioral health services and preventative medicine and addressing social determinants of health and keeping people well and healthy is financial. And so I was wondering when we're going to start seeing the incentive shifts towards prevention with some of the accountable care organizations and some of the healthcare reform laws that have been passed.
Sure. I mean, I sit on the mental health committee, so I've heard a lot of these bills that talk about kind of, how well covered you are if you kind of break your arm, and it's something very tangible that you can see. But if you're suffering from a mental health issue and you have kind of invisible wounds, it's really hard to get the treatment and coverage that you need. And so there's been a couple different bills that we've heard in our community at the state level to kind of make sure that they're treated equitably, and I think they absolutely should be treated equitably, and we've seen that play out here on island, where there are just so many kind of mental health issues here that kind of go untreated and need the healthcare coverage and insurance that they deserve. And so that's something that we're hearing a lot about on the state level. It's something obviously I'm very supportive of. Unfortunately on Nantucket right now, we're going through a suicide contagion at the moment. And so one of the things that we've been doing, our offices have been doing, has been working with Department of Public Health to see if we can get additional resources here on island. And we've had a phone call with several people across the island to try and see if we can get the state a little more involved in helping out with mental health issues that are going on here. And then Julian, do you have anything to add? Because Julian worked for 6 years in the Department of Public Health, so he probably has more of a background on this.
And this is actually an issue the Senate has been discussing for some time, and I think you're going to see us take up a bill on healthcare reform in the coming weeks. Parity for behavioral health is just something that is in law, but has not been realized. I think in Massachusetts, the real challenge that we have here, I think we've done a good job in getting access to care, right? So we have 98% of our population's insured. Many of the folks who live here have access to a doctor of some sort. There's work that needs to do, right? The cost of that system has been costly and has been rising. So 43% of the state budget is now devoted to mass health, and it's over 50% when you count in all the other work that public health, mental health, elder affairs work does. So this is the part of the budget that's been growing. And whereas we have a really good product with Mass Health. More and more people have been opting on to Mass Health, particularly if you look at Affordable Care Act implementation sort of changed criteria for when employers had to provide what level of insurance. And so now there's a real sort of debate about how do you get, do you push or incentivize or you know, with a stick sort of force people back onto their employer provided insurance? Do you actually say, hey, people are opting into Mass Health because it's better care, which I kind of tend to agree with. Do we allow people to buy into the Mass Health system, like what was passed by the Nevada legislature into their Medicaid program? This is sort of the issue that the legislature is going to take up. The Senate's going to go first on that. There is some components on behavioral health. I think we realize that behavioral health really makes a difference from not only a quality of life perspective, which is the most important piece, but also from a cost perspective. There are some challenges specifically around providers in certain areas. Often when it comes to care, who can do what and where is sort of a big debate, right? Because the state sort of determines this from a licensure perspective and from a statutory perspective or perspective in law, who can do what, right? Can your physician's assistants do something? Can a social worker do this? Can a licensed social worker, a psychotherapist, what have you? That in a place like Nantucket or Martha's Vineyard or Cape Cod really can be a constraint in getting access to care. Actually, a place we've been working on this is actually in dental care. So there is no provider on these islands that takes Mass Health for dental care. I think there may be one provider who takes Mass Health on Nantucket, but there's no provider in Martha's Vineyard. So if you're on Mass Health and need dental care, that means a trip off island. You know, could we not do this in a more reasonable way with sort of dental assistance providing a certain level of work? This gets into sort of like the guild warfare, basically, right? Who can do what? And because in Massachusetts, this is a really big part of our economy. So you're gonna see us taking up comprehensive healthcare reform in the Senate. I think the House is gonna follow suit. I still don't know what's specifically in there, but I think you're gonna see a whole host of topics in there. Behavioral health is something that I know we're looking at, hospital readmissions, something called provider price variation. So different providers and different hospitals get reimbursed by insurers at different rates. That actually makes sense if you're running a hospital on an island or on a peninsula. Does it make sense if you're a partner, if you're like Mass General or the Brigham, who are getting higher reimbursement rates than say a community hospital in suburban Boston. So those are just some of the fights that are kind of to come. I think that would be really helpful to hear from folks, right, is as this legislation comes out, getting feedback from you on how this would help or would adversely impact the island and the community in often bills of this scale. I like to talk about healthcare policy. You know those rubber band balls that you get at Staples or actually the hardware store here. We don't have Staples here, thank God. It's like a whole big knot of like rubber bands, and you got to take them off one at a time. So that's what healthcare policy and our healthcare system has really become. And so, look, I'm a big believer that there's got to be a better way about doing this. I've sponsored actually a bill that looks at, basically would require the state to study what a single payer system would cost and to benchmark that basically and to look at that over a certain period. But sort of the undoing of this knot, right, is gonna, taking off all those rubber bands, right, is gonna take a while. There's a lot of factors there. So, I think when this bill comes out, when we get a draft of it, I'd be glad to give you my card and we can shoot it over to you and specifically look at the behavioral health portions that are in it. But we have a long way to go.
Dylan, this question may resonate because I asked it of you 9 months ago on your first visit to the island. The subject is renewable energy. Wind and solar, I guess, each have the right to claim the title of poster child. I would suggest that the title of stepchild is what you would give to tidal energy. There's a great deal of use of tidal energy in Europe, so it obviously capital is flowing in that direction, and it has an adequate return. But I see things going in the other direction in the state. There was a small project being considered in the waters between here and Martha's Vineyard that got dropped. So my question is, what is this state doing in the area of tidal energy?
Sure. So right now there's a project going on by Mass Maritime. They're taking a school project to look at tidal, specifically in the canal, which has some of the fastest currents in Massachusetts, maybe the fastest current in Massachusetts. So there's been some exploring into how tidal can be effective. There's a project, kind of a pet project around Muskegon Channel that an individual has been looking at for years, and I believe he actually just got additional permits to look further at it. So that's Muskegon's right off of the Vineyard. That's something that is being explored. Tidal is tough. Tidal is tough. I mean, the countries that's doing tidal the most is England, right? But Scotland and Ireland have all looked at tidal. It's just, the problem is it's not as efficient and as effective as solar and wind right now. But we know that when it comes to sustainability, nothing is more sustainable than tidal, right? The wind doesn't blow every day, the sun doesn't shine every day, but if the tides start running, we have some bigger issues, right? So.
As you get north of the Nixon line, solar is less.
Sure. I mean, let's take Massachusetts for an example. Massachusetts is the 35th sunniest state in the nation. In January, you see the sun like 2 days a month, right? But we have the second highest number of solar jobs in the entire country in Massachusetts, and we're 7th in solar output in the country. And that's because Massachusetts has really taken a step forward and stepped up when it comes to its solar tax credits and supporting renewable energy through the Global Warming Solutions Act and the like. But where we have a competitive advantage when it comes to our just resources, but specifically energy, is wind. Massachusetts is, especially here, is the windiest place in the nation. So, and wind is significantly more efficient than solar is. You get at issues of NIMBYism a whole lot more with wind than you do solar, and that's certainly an issue. My hometown of Falmouth is becoming a poster child of that. I don't really want to get into that here. But we have a really exciting project 15 miles kind of southwest of Nantucket, about 13 miles south of the Vineyard, and that is we're going to have the largest deep water offshore wind farm in America. This is a place where it's the windiest place in America. It's called the Saudi Arabia of wind. That's how they're billing it. A little off message, I'd say, but you get the point. And so that is really exciting. And right now, if we have the capacity in this region, which luckily is in no one's backyard, right, which makes it a little more palatable. We have the capacity for Massachusetts to get 65, upwards of 70% of its energy if the plot is fully explored from deep water offshore wind. And when we talk about kind of moving towards 100% renewable, which is those are conversations that are being had at the State House, and conversations we frankly need to have. Deep water offshore wind is really kind of the largest component. And, my background's in economics. You want to, when you're planning your resources, you want to push them to where you have a competitive advantage. Massachusetts, we have an incredible competitive advantage when it comes to wind, especially deep water offshore wind. And I think it's something that's really exciting. And also, just kind of as a broader point, Massachusetts is ranked #1 when it comes to clean technology and clean energy in the nation. But that's a horrible benchmark, right? Because the U.S. is just awful when it comes to clean energy and mitigating our greenhouse gas emissions. So that's a really bad, it's something to be proud of, but a really bad benchmark. And so, we know, and if you just look at world history, just your basic kind of elementary school and high school history, you know that whoever controls energy production in the world controls geopolitics, right? I mean, if you look at all the kind of hot spots in US history, most of them are around energy production. This is a case where we know what the future of energy production is going to be for the world. It's going to be clean energy, and we know that it's coming, and it's coming rapidly, not 100 years down the road, but 20, 30, 50 years down the road. If Massachusetts can take steps to become a leader in clean energy, well, then we're going to get the benefit of all of those jobs and all of that kind of political power and money that comes with being a world leader in energy. So I think that's a real opportunity for us as a state to become that leader and really control our own future. Let's have a
Question up the back.
Maria? Oh, sorry.
Oh, thank you for coming. This is a little off topic, but there's a huge concern about cancer, especially in young people in Nantucket and the Cape and the islands, other island. We were doing some investigations into that, and it seems like pesticides might be a big factor when you're living in basically a cup of water and drinking out of it. I know that Connecticut has tried to overturn the pesticide limitation ban, which prevents every county and town from imposing any restrictions at all on pesticides at a greater level than in the state itself, and which is a pretty vague limitation. And I'm wondering if you think there's any chance of overturning it in Massachusetts and allowing us to impose a stricter ban. And just for the people who aren't as concerned about pesticides as I am, about 6 out of 2,000 of them have actually been tested for harm to humans in the US, even when they've been proven to be harmful in the EU and other countries, have banned them. And they've never been tested in combination, which is the way that they're usually sold. Unknown harmful chemicals mixed together with an unknown consequence.
Yeah, it's a really good question. So this is a pretty fascinating issue. I'm well aware of the high cancer rates. My father got cancer when he was really young, and he's a lifelong Cape resident. So there's a lot of different issues surrounding pesticide spraying and pesticide use. One of the most concerning that we've had come up is, you guys don't have Eversource, but Eversource spraying glyphosate on our sole source aquifers. And on the Cape, on Nantucket, on the Vineyard, we all have a sole source aquifer, right? We only get one shot at a sole source aquifer. So it's really important that what we're dumping on it is safe and not harmful to human beings. So there are a couple of states in the United States that allow local municipalities to restrict pesticide use. Maine is one, I believe Vermont is another, but there's only about a handful. Most are preempted by state laws. And so the state law is the ceiling. You can't go any higher than that. And ALEC, this kind of conservative group that issues state laws to make them more conservative, has actually used this kind of boilerplate language to make sure that preemption stays in place. For over 35 states have the exact same pesticide language, just copied and pasted in the other state statute around not allowing local communities to ban pesticide use. So in Massachusetts, we don't have that boilerplate language, but we do have the Department of Agriculture, which oversees the pesticide board, and they decide which pesticides are usable and which ones are not usable. The Department of Agriculture they're not an environmental organization, to say the least. And so all they really care about, and on their commission, is just people who work and agriculture. And so they don't, when it comes to pesticide restriction based on health issues, they're not looking into that. One of the things that I would like to see our state do is move the pesticide board out from the Department of Agriculture and under the Department of Environmental Protection. That would go a really long way towards having more sane pesticide restrictions. My bill goes further than that because I think we should be going further, and that my bill would make it so that, sure, DAR, pesticide board, they set the floor, but the local community set the ceiling. And that I think is really important because it empowers locals to decide what is being dumped, what chemicals are being dumped into their drinking water. And as our senator, so astutely pointed out, our water is our biggest resource here. It is so important that we make sure it's protected. And so when it comes to the different chemicals, glyphosate, the data is out on whether it's carcinogenic or not. Neonicotinoids, as I said earlier, it's looking more and more like they're killing all of our pollinators. But my question is, if the data is out on something being carcinogenic or not, let's just not dump it. If we don't know if it's going to cause cancer, let's be a little more proactive. Let's not put it on our sole source aquifer. And so this is a newly filed bill. It's already gotten a lot of attention. A lot of groups have reached out in support, and I filed it with the Sierra Club. We worked together on this piece of legislation. It's also already gotten a lot of opposition, which has been kind of fun. Different groups emailing me that different kind of golf courses aren't big fans, as you can imagine.
That's when you know you're doing something.
I know. I was so excited to get all these "How dare you file that bill" emails. But this is a really nice piece, and it's something that will bring us in line with more sane pesticide regulations. And 55 years after Silent Spring by Rachel Carson, I think it's time that we take a renewed commitment to pesticide restriction.
I would just add that there's a great resource at the state level around a cancer registry, which I would suggest reaching out to at the Department of Public Health. The tough thing about environmental exposures, and I worked on this issue in environmental health for 3 years at the Department of Public Health, is it just takes a really long time to get that, definitive causal link. There's actually only 2 instances in the United States where there's actually been a causal link between an environmental contaminant and cancer, right, definitively. One of that actually was in Woburn. My old boss actually led that effort, and the other was in the Carolinas. So, I think increasingly in a world where there's a lot of concern about contaminants, and I think that concern is justified given that we've had a whole history of having products that we thought were totally great, whether it's asbestos or lead, and we're now dealing with those consequences that we need to be looking at that. I actually filed a bill that aims to move, so if you look at the pesticide board under the Department of Agricultural Resources, they sort of do the administration side of it, but a whole host of folks have other seats on it. There's 2 seats in public health, a toxicologist and food protection, environmental DEP also. I think it's really important that when they're taking up, right now there's sort of no redress, right? If the pesticide board says, you're done, right? And so I filed that language that basically said, look, if you're dealing with a water source, especially in a sole source aquifer, then the Department of Public Health and the Department of Environmental Protection needs to basically concur with that. And as Dylan sort of said, they have sort of higher standards there. I think the other thing that's really important when we're talking about environmental contaminants and potential exposures is being really honest about what steps people can take if they're concerned. Because again, right, the evidence that it takes so long for us to sort of get that definitive evidence that really, I think it's incumbent upon government to say, all right, if you are concerned about this, what are steps you can take? Well, under the current regime, you as an individual can't take certain steps given the regulatory framework. I would mention on tidal power, I think that there's something, the Clean Energy Center definitely has some interest and incentive in this. I think that in this issue, it would be interesting to see if there was more impetus, or some impetus at a municipal level or a local level in trying some things out more regionally. I think part of the challenge is just not having enough really case studies. That could be something that, I don't know if the town was interested in that, but I think that that would be something that would be well received. And then, sir, to your question way back when around deeds excise, there's the bill, if you're interested, it's House Bill 1499, and it's an act relative to deeds excise receipts. So we can get that information to you, but if you folks are interested in deeds excise, that's the bill.
Okay, we have another question from the back of the room.
I heard this from a student, and he said that water and healthcare should be free, and I wish it could happen. But this is relevant to students too. That this is what I'm going to ask is about DACA. I want to know what's an update of what's happening in the state level, because in the federal level, everything is very sad. We have heard that these students will have no more opportunity, will not be benefit, with that real good law. And I have heard that several things that they want to make them do things that they shouldn't be doing, betraying their families and friends. And also that if they will change it or they will leave it, and if they leave it, they'll make it better, but they want them to pay for the wall, things like that. So what I want to know is an update of what's happening in the state level and concerning on these students, and if there's workshops or anything, any information that can come to the island and give it to everybody here, so they can have more. We can all have more a better understanding on what DACA is, what it can happen. And so students also can know what to do, what not to do. They also want to go, to start developing the leadership roles and doing stuff, going to conferences, and they don't know if they should do it or not do it. There's so much good stuff they can do, and it's like, no, you cannot do. And it's just putting them in a back in the shadows and not stepping up for what they want to do and they should do.
Thank you, Maria. I think clearly in my perspective, it's a pretty terrifying moment, I think, in our country, and I think in our history, we'll look back on this as a sad, unfortunate moment in American history. I think there's a lot of unknowns on sort of what's happening in D.C. around DACA and probably following Donald Trump's Twitter feed may be a better, maybe a way to sort of see what's going on there. I think more locally, what's really important is several things. Dylan and I are both co-sponsors of the Safe Communities Act, filed by our colleague Juana Matias of Lawrence, who is actually a first-generation American herself. And essentially what it would basically say is that, look, the municipalities, municipal resources, police resources, public safety resources can't be used in immigration enforcement, right? Actually, there was a case that went before the Supreme Judicial Court in Massachusetts earlier this year, and that actually sort of affirmed that. We're still pushing for safe communities to have some additional protections. I think it's really problematic when you have a federal government threatening to take repercussions against certain municipalities. In Massachusetts, all the municipalities are chartered through the state, so I feel we really have an obligation to protect our communities. And I really, defer to our communities, select boards, chief of police, and also, our communities themselves around what they'd like to see there. I think that DACA, I think we're going to be seeing this unknown period, right, around what's happening at the federal level. I think maybe if there's some things we can do in working with Congressman Keating and some of our federal partners and getting out some sort of regular update, right, because you feel it's changing all the time. I think what's really important as well is that we do a good job here in our communities, engaging with all the people who live in our communities. I think that one of the most, effective things that we can have is make sure that not only DACA recipients, but all immigrants in our communities, right, really feel part of our community, right? That they're not separate from our community, that they are integrated into our community, and so that if, and God forbid, when certain action is taken against individuals, you really have a community network and fabric that's there. I don't necessarily see that in all the communities. I mean, I don't know Nantucket as well as I know my community on the Eider Cape. I do know that when ICE actually came to Provincetown to actually do routine work, it turns out they were actually there to check up on some green card applications for marriages, that, you know, there was just widespread panic in town, and most business owners actually sent their foreign employees home, regardless of their status, right? Just wanting to, of a whole fear, right? Of what that means and what can happen to folks, and that's just, you know, that is it's unacceptable. That's the environment we live in. It's understandable that people feel that way. My family owned a business. I would feel that way. So I think from a state level, safe communities, I think having the court order, I think is helpful. You are not going to see law enforcement, municipal law enforcement in Massachusetts aiding and abetting federal immigration enforcement folks. You're not going to see that under the Supreme Court decision, and I think you're not going to see that if we take further action in the legislature. So I think that's really important that we get out there, and I think the more integration and inclusion and active efforts that we can take in really making sure that everyone who's in our community, you know, everyone who really is in our community is part of our community. I think Nantucket, you know, this is a place that the census says there's 10,000 people, and we know that there's 14 or 15,000 people who live here in the center count, right? We think this is a place where I think some work has been done. We can do a lot more work, but also too, I think that's on the folks who live here. You know, Dylan, I'm sure you have a lot to add on this. You've been really a great advocate on safe communities and trying to move this forward.
Yeah, I mean, you know, it's really frustrating, especially as someone who works at the state level, because there's just, you know, we have so much less power to affect change on immigration because it's really, you know, it's in large part a federal issue. And if I had it my way, you know, we would not be in this situation at all. And I come at this as someone, you know, I talked about my kind of how my family immigrated here from the Azores. You know, we're all immigrants in this country. The only people who aren't immigrants are Native Americans and African Americans who were brought here because of slavery, right? We're all immigrants. And so this kind of anti-immigrant sentiment that's cropped up in the past year has been really, probably over a year, has been really disturbing to me. And I think we need to be doing everything we can to protect our immigrant community. And the Safe Communities Act is really the best thing that I think that we can do for Massachusetts. And to the more conservative colleagues who are, you know, I get emails pretty frequently from the more kind of right-wing groups and right-wing people in the district saying, you know, how dare you, you know, protect our immigrants? How dare you sign on to the Safe Communities Act? You're making our communities more dangerous if this passes. Well, that's just not true at all. You know, first of all, we know our communities will be safer if immigrants and especially undocumented immigrants feel comfortable going to the police to report crimes. There's been a huge drop-off in reporting of crimes from immigrant communities in our state, and so issues like domestic violence and sexual assault are not being reported like they should in our state. And, you know, the Attorney General's office will tell you this. They've seen a huge drop-off in those types of cases. So this anti-immigrant sentiment is making our communities less safe, right? And so that's why it's really important we have this bill. Additionally, you know, the conservatives that I hear from, you know, are, you know, these big kind of fiscal conservatives are saying that we should be using state resources to do federal law. That's costing our state money to do something that the feds are supposed to pay for. That's fiscally irresponsible. I mean, putting aside the whole like just basic human compassion piece, right? That's just fiscally irresponsible. And so this is a really important piece. It's something that has over 100 co-sponsors, and is really something that we need to push leadership in the House to move on, quite frankly. Here, Julian snickering over there. So, I'm part of a more progressive wing in the House, and we've sent letters to the Speaker about our top priorities this session. Safe Communities Act was one of them. It's something that a group of us are pushing really hard for. It's something that's common sense, will protect people, will make our state safer, and save our state money. So we're gonna keep fighting for it. And again, it's really frustrating that I can't do more on this.
I think the other piece that's really important here, and probably Dylan and I could talk about this all night, but is really recognizing how dynamic and integral all immigrants, but especially recent immigrants, are to our communities here in our region. And this is especially true in Nantucket. And actually, I think there's been a lot of that this island has advantages and opportunities because of the immigration that you've seen here, because of, and it's a whole kind of amazing United Nations of communities that have really established communities here. Nantucket is the only school district that I represent that is not losing enrollment in your schools, you're gaining enrollment in your schools, right? When Dylan and I were coming up, in the 90s for the school systems, Nantucket had about 1,000 students in your public school system. It's now 1,500. That is a huge opportunity and advantage for your folks, all right? Most of the communities that I talk to, and the superintendents and school committees that I talk to on the Cape, are talking about, you look at the enrollment numbers. So the enrollment numbers in the schools, when I was a senior in high school, the kindergartners were half the size of my high school class. Now those kindergartners are seniors in high school, or soon. And the kindergartners, that class is even in half still. So whereas elsewhere in the region, we have a crisis in population. My hometown, by 2030, 65% of the population of Truro will be over 65. Do you know what a disaster that is if you're living on a peninsula 30 miles out in the Atlantic Ocean, or worse, on an island 30 miles out in the ocean? So really, for this island, for Nantucket, immigrants are really part of a big reason why, if this place has any hope of being sustainable before it goes into the ocean, maybe 1,000 years, right? Like, that is going to be dependent on community and on the people who've been able to come here, and it's immigrant communities who've been able to do that. And I think that that's really important on Nantucket. And I'll be really honest, the first place on my campaign, where I heard nativist rhetoric was right here on island. So I remember it was Daffodil Weekend, and someone said to me, "Oh, all those immigrants, they're taking my jobs." That's not some far off place. That's right here on island. And I think that is really important. I can only sort of share what was reflected to me, right? I don't live in this community, I represent it. But that's a factor, and it's alive and well here, and it's something that I heard here that I didn't hear as much of. Really, I'd only hear on conservative talk radio, right, where it sort of uses the red herring. But that's really real here, and I think that, at least from as an outsider's perspective, and I know I'm not an islander, but I really see the vibrancy of these immigrant communities as a real opportunity for you folks, and I really wish that we had the same level of dynamic immigration elsewhere in the district, because we're facing some really big challenges that you guys are fortunate that you don't have to face. So sorry, that's my soapbox on immigration.
Well, thanks to all of you for a wide range of thoughtful questions on some very critical issues. But we've come to the end of our Q&A portion, and would ask our state legislators to make closing comments. And why don't we start with you, Representative Fernandes?
Sure. Well, just thank you all for coming out tonight. It's been a pleasure. I've been in this room probably 10 times in the last 5 months. I'm here very often, and I think I recognize almost every face in this room. Part of being state rep and representing a district that is the most unique in the Commonwealth, because I represent 3 different sets of islands, I'm the only rep that represents 3 different counties, and I represent 2 sounds as well. And so I sit next to this guy who's from Peru, Massachusetts, and I came in and sat down next to him, and he started complaining to me about, Peru's out in Western Mass, started complaining about this long district he had to drive across, and it took him about 2 hours to drive from one end of the district to the other. And I just looked at him and was like, Mark, it takes me 2 days to get across this district. And he's shut up ever since. So, look, but it is such a pleasure to serve this district. I mean, it is uniquely beautiful. The people here kind of outshine the beauty of this place. And it's amazing just how ingrained and engaged people are in their local community on Nantucket and how much they care about the island. And that's really helped inform my work. When I ran, I knocked on I don't know how many doors on island and just talked to people about the issues that they're facing right in their homes. And the feedback that I've gotten has helped inform the work that I've been doing on the state level. So I'll just say that keep in touch, reach out to me. My personal cell phone is still on the front page of my website. No one has abused that yet, so we're gonna keep it there. But also our office is really accessible as well. Reach out anytime. We're here to help you on any issue, and we want your feedback. We want your outreach, because that makes me a more effective voice for you on the state level. Thank you.
Yeah, well said, Dylan. I think that, both of us can, to do our jobs to the best of our ability, we really need, to hear from folks, and we really need your ideas. We can't be here, all the time. Having, please being in touch with our community, with our offices is really, really vital for us. Likewise, just as accessible. I think that's a real key piece in having a relationship with us. If there are folks that, aren't here tonight, but you think would, or folks watching on TV, who would like to spend some time with us when you come back over on island. I try to get here about once a month, sometimes twice a month. We're glad to sit down. Please invite me and us to opportunities and to things. And it's just a real honor to be able to represent all these wonderful people who live here. And I think as well that, I think the best part about politics for me, right, is the relationships you get to build with people, right, and how in coming to this island and where the island hospitality is just incredible, right? Every time I'm here, the host outdoes themselves even more, but that people really are becoming friends and lifelong friends, and I think that's one of the most special parts of getting to have this job, right? Is that it's not just we get the privilege of getting to go up to Beacon Hill and advocating for this region, but we also get to develop a whole extended family and a whole extended community here, and I'm just really grateful for so many people who are in this audience and so many folks who aren't here tonight, who've really just been so gracious and wonderful, and I'm really looking forward to continue to do this. So thank you again to the League for the opportunity to be here, and we'll certainly stick around and answer any other questions you have.